Question 1. A patient is admitted to the hospital with acute respiratory failure due to an acute exacerbation of chronic obstructive pulmonary disease, COPD. The attending physician documents that the respiratory failure is the reason for admission and is receiving mechanical ventilation. What is the correct principal diagnosis for this inpatient encounter? A. J44.1, chronic obstructive pulmonary disease with acute exacerbation. B. J44.9, chronic obstructive pulmonary disease, unspecified. C. J96.00, acute respiratory failure, unspecified. D. R09.2, respiratory arrest. Answer: C. J96.00, acute respiratory failure, unspecified. This question tests understanding of principal diagnosis selection in inpatient coding, specifically when an acute condition complicates a chronic one. The keyword principal diagnosis indicates the main reason for the hospital admission, which is the condition established after study to be chiefly responsible for occasioning the admission. In this case, the acute respiratory failure, not the chronic COPD exacerbation itself, is documented as the reason for admission and is what necessitated the intensive care and ventilation, making it the principal diagnosis. Remember, the principal diagnosis is the condition driving the inpatient stay, even if it's a complication of another condition. Question 2. A 65-year-old male receives an annual flu shot in the physician's office. Which code category would be used to report the administration of the vaccine? A. Evaluation and Management, E/M, codes. B. Medicine codes. C. Surgery codes. D. Radiology codes. Answer: B. Medicine codes. This question focuses on the appropriate CPT code section for vaccine administration. The key phrase annual flu shot points to preventive medicine and immunization services. Vaccine administration codes, like CPT codes 90,460 to 90,474, are found within the medicine section of the CPT manual, specifically under immunization administration for vaccines/toxoids. These codes cover the act of giving the shot, separate from the vaccine product itself, which is typically coded with a CPT or HCPCS Level II code. When coding, always look for the most specific section that describes the service provided. Question 3. Which of the following is the primary purpose of the Healthcare Common Procedure Coding System, HCPCS, Level II codes? A. To report physician services and procedures. B. To report hospital inpatient services. C. To report durable medical equipment, prosthetics, orthotics, and supplies. D. To report diseases, injuries, and external causes of morbidity. Answer: C. To report durable medical equipment, prosthetics, orthotics, and supplies. This question assesses knowledge of the different coding systems and their primary uses. The core concept here is understanding the scope of HCPCS Level II. While CPT, HCPCS Level I, is used for physician services and ICD-10-CM for diagnoses, HCPCS Level II codes are specifically designed to report items and services not covered by CPT, such as ambulance services, drugs, and particularly durable medical equipment, DME, prosthetics, orthotics, and supplies, DMEPOs. These codes ensure consistent reporting for billing Medicare and other payers for non-physician services and supplies. Question 4. A patient undergoes an ultrasound of the abdomen, limited, to assess for gallstones. What is the correct CPT code category for this service? A. 70,000 series, radiology. B. 90,000 series, medicine. C. 80,000 series, pathology and laboratory. D. 10,000 series, integumentary system. Answer A. 70,000 series, radiology. This question tests the fundamental organization of the CPT manual by medical specialty. The keywords ultrasound and abdomen clearly indicate a diagnostic imaging procedure. All diagnostic imaging services, including X-rays, MRIs, CT scans, and ultrasounds, are found in the radiology section of the CPT manual, which encompasses codes in the 70,000 series. Knowing the main sections of the CPT manual is crucial for quickly locating the correct codes. Question 5. The combining form arthr/O refers to which part of the body? A. Bone. B. Joint. C. Muscle. D. Cartilage. Answer B. Joint. This question tests basic medical terminology, specifically the meaning of a common combining form. The combining form arthr/O is consistently used in medical terms to refer to a joint, such as in arthritis, inflammation of a joint, or arthroscopy, visual examination of a joint. Understanding common prefixes, suffixes, and root words is essential for medical coders to decipher medical documentation accurately. Question 6. A patient is seen for a follow-up visit after a recent myocardial infarction. The physician reviews the patient's current medications, assesses their cardiac status, and discusses lifestyle modifications. This encounter would primarily involve which key component for evaluation and management, E/M, coding? A. History. B. Examination. C. Medical decision-making, MDM. D. Time. Answer C. Medical decision-making, MDM. This question assesses understanding of the key components for E/M coding for office and other outpatient services. While history and examination are performed, the most significant component in this scenario, especially for a follow-up after a serious event like a myocardial infarction, is medical decision-making. The physician's thought process involving the number and complexity of problems addressed, the amount and/or complexity of data reviewed and analyzed, and the risk of complications and/or morbidity/mortality drives the MDM level. For many E/M services, particularly starting in 2021 for office and other outpatient E/M, MDM or total time is the sole determinant of code level, making it a critical focus. Question 7. According to ICD-10-CM guidelines, how is a bilateral condition typically coded if there are separate codes for laterality, right/left? A. Code only the more severe side. B. Code only the right side. C. Code both the right and left sides. D. Code an unspecified laterality code. Answer C. Code both the right and left sides. This question tests a specific ICD-10-CM guideline regarding bilateral conditions. When a condition is bilateral and the ICD-10-CM classification provides separate codes for the right and left sides, the guideline specifies that both the right and left codes should be assigned. An example is carpal tunnel syndrome, where separate codes exist for right and left carpal tunnel syndrome. Remember to always apply the most specific codes available according to the documentation and official guidelines. Question 8. Which government agency is responsible for enforcing the Health Insurance Portability and Accountability Act, HIPAA, security rule? A. Centers for Medicare and Medicaid Services, CMS. B. Office of Inspector General, OIG. C. Office for Civil Rights, OCR. D. Food and Drug Administration, FDA. Answer: C. Office for Civil Rights, OCR. This question examines knowledge of healthcare regulations and the agencies responsible for their oversight. The HIPAA security rule protects electronic protected health information, EPHI, and the Office for Civil Rights, OCR, within the U.S. Department of Health and Human Services is the primary agency responsible for enforcing the privacy and security rules. Understanding which agencies are responsible for different aspects of healthcare compliance is important for maintaining legal and ethical coding practices. Question 9. A patient is diagnosed with type 2 diabetes mellitus with diabetic neuropathy. How should these conditions be coded according to ICD-10-CM guidelines? A. E11.9, type 2 diabetes mellitus without complications, G63, polyneuropathy in diseases classified elsewhere. B. E11.40, type 2 diabetes mellitus with diabetic neuropathy, unspecified. C. E11.42, type 2 diabetes mellitus with diabetic polyneuropathy. D. G63, polyneuropathy in diseases classified elsewhere. Answer: C. E11.42, type 2 diabetes mellitus with diabetic polyneuropathy. This question tests the ICD-10-CM coding guideline for with and due to relationships, particularly common for diabetes. When documentation links conditions like diabetes with neuropathy, ICD-10-CM presumes a causal relationship. Therefore, you should look for a combination code that includes both the diabetes and the associated complication, such as E11.42, type 2 diabetes mellitus with diabetic polyneuropathy. This combination code concept simplifies coding by reflecting the full clinical picture in a single code. Question 10. A physician provides an established patient with counseling for smoking cessation during a routine office visit. The counseling lasted 12 minutes. Which CPT code category would be most appropriate to report this service? A. E/M service code with a modifier. B. Health and behavior assessment/intervention codes. C. Preventive medicine codes. D. Medicine codes for smoking cessation counseling. Answer: D. Medicine codes for smoking cessation counseling. This question focuses on specific CPT coding for counseling services. While the patient had a routine office visit, an E/M service, the smoking cessation counseling is a distinct, separately reportable service if it meets the time threshold for the specific counseling code. CPT provides specific codes, example 99406 to 99407, within the medicine section for smoking cessation counseling based on the duration of the counseling. Always look for the most specific code that precisely describes the service provided, even if it's during another type of encounter. Question 11. Which body cavity contains the heart and lungs? A. Abdominal cavity. B. Pelvic cavity. C. Cranial cavity. D. Thoracic cavity. Answer: D. Thoracic cavity. This question assesses basic anatomy, specifically the location of major organs within body cavities. The thoracic cavity, also known as the chest cavity, is located above the diaphragm and is where the heart, lungs, esophagus, and trachea are housed. Understanding basic anatomical locations is crucial for accurately interpreting medical documentation and assigning the correct codes. Question 12. A patient is taking warfarin, Coumadin, for a history of deep vein thrombosis. Warfarin is classified as what type of drug? A. Analgesic. B. Anticoagulant. C. Antibiotic. D. Antidepressant. Answer: B. Anticoagulant. This question tests basic pharmacology knowledge, specifically drug classifications. Warfarin, commonly known by its brand name Coumadin, is a well-known medication prescribed to prevent blood clots. Therefore, it is classified as an anticoagulant. For coders, understanding basic drug classifications can help in identifying conditions being treated and potential adverse effects or interactions. Question 13. In the context of the National Correct Coding Initiative, NCCI, edits, what does a mutually exclusive edit indicate? A. Two codes that can never be reported together. B. Two codes that can be reported together with a modifier. C. Two codes that describe services performed at different anatomical sites. D. Two codes that describe services performed by different physicians. Answer: A. Two codes that can never be reported together. This question tests knowledge of NCCI edits, which are crucial for preventing improper coding. A mutually exclusive edit means that two procedures cannot reasonably be performed on the same patient during the same encounter because they are medically impossible, illogical, or represent alternative approaches to achieve the same outcome. Unlike column 1/column 2 edits that can sometimes be bypassed with a modifier, mutually exclusive edits generally indicate that the two services are inherently contradictory and cannot be reported together. Question 14. A patient is admitted to the hospital with sepsis due to a urinary tract infection, UTI. The physician documents urosepsis. What is the correct coding approach? A. Code for UTI only. B. Code for sepsis and UTI, with sepsis sequenced first. C. Code for urosepsis only. D. Code for UTI and urosepsis. Answer: B. Code for sepsis and UTI, with sepsis sequenced first. This question addresses a common coding scenario involving sepsis and its underlying cause. The term urosepsis is often documented, but in ICD-10-CM, it is not a specific diagnosis but rather indicates sepsis due to a urinary source. Therefore, the official guidelines direct coders to report two codes, one for the sepsis, example A41.9 for unspecified sepsis, and one for the underlying urinary tract infection, example N39.0 for UTI, with sepsis sequenced first as the more severe condition driving the treatment. Question 15. The abbreviation PRN commonly seen in medication orders stands for A. As needed. B. By mouth. C. Immediately. D. Every night. Answer: A. As needed. This question tests understanding of common medical abbreviations found in patient records. PRN is a Latin abbreviation for pro re nata, which translates to as needed. Medical coders encounter many abbreviations in clinical documentation, and knowing their meanings is essential for accurate abstracting and coding. Question 16. What is the primary purpose of ICD-10-PCS, Procedure Coding System? A. To report outpatient physician procedures. B. To report hospital inpatient procedures. C. To report hospital outpatient procedures. D. To report durable medical equipment. Answer: B. To report hospital inpatient procedures. This question differentiates between various coding systems based on their application. ICD-10-PCS is specifically designed for reporting procedures performed in the inpatient hospital setting, used for reimbursement and data collection. It is a highly granular, 7-character alphanumeric system that differs significantly from CPT, which is used for physician and hospital outpatient procedures. Question 17. A patient presents with a laceration of the hand and the physician documents simple repair. How would this repair be classified based on complexity for CPT coding? A. Complex repair. B. Intermediate repair. C. Simple repair. D. Debridement. Answer: C. Simple repair. This question tests knowledge of wound repair classifications in CPT coding. The keyword simple repair directly indicates the lowest level of complexity for wound closures, involving a single layer closure of skin or mucous membrane, with or without minimal debridement. CPT guidelines define simple, intermediate, and complex repairs based on the layers involved, extent of debridement, and special closures, with simple being the most basic type. Question 18. When a patient receives general anesthesia for a surgical procedure, what is the primary factor used to determine the base unit value for anesthesia coding? A. The patient's age and health status. B. The specific body site of the surgery. C. The type of anesthesia administered. D. The relative value unit, RVU, assigned to the surgical procedure. Answer: B. The specific body site of the surgery. This question focuses on the core principles of anesthesia coding using CPT. For general anesthesia, the base unit value is primarily determined by the specific surgical procedure performed, which dictates the complexity and risk associated with the anesthesia care for that anatomical site. CPT codes for anesthesia 00100-01999 are typically chosen based on the surgical site, example 00400 for procedures on the neck, and are combined with time units to calculate the total anesthesia units. Question 19. A patient is diagnosed with metastatic carcinoma to the bone from a primary site in the lung. What is the correct sequencing for the primary and secondary malignancy codes in ICD-10-CM? A. C79.51, secondary malignancy of bone, C34.90, malignant neoplasm of unspecified part of bronchus or lung, unspecified. B. C34.90, malignant neoplasm of unspecified part of bronchus or lung, unspecified, C79.51, secondary malignancy of bone. C. C80.1, malignant, primary, neoplasm, unspecified site, C79.51, secondary malignancy of bone. D. C79.51, secondary malignancy of bone, only. Answer: B. C34.90, malignant neoplasm of unspecified part of bronchus or lung, unspecified, C79.51, secondary malignancy of bone. This question tests the ICD-10-CM guideline for coding primary and secondary malignancies. When a patient has both a primary malignancy and a secondary, metastatic, malignancy, the primary malignancy is generally sequenced first, followed by the secondary malignancy. The patient's treatment typically targets the primary source of the cancer. Therefore, the lung cancer, primary, is coded first, then the bone metastasis, secondary. Question 20. Which of the following is an example of an advance directive? A. Medical power of attorney. B. Progress note. C. Discharge summary. D. Operative report. Answer: A. Medical power of attorney. This question assesses knowledge of legal documents in healthcare, specifically advance directives. An advance directive is a legal document that allows individuals to make decisions about their future medical care. A medical power of attorney, also called a durable power of attorney for healthcare, is a type of advance directive that designates a specific person to make healthcare decisions on one's behalf if one becomes unable to do so. Understanding these documents is part of the broader context of healthcare information management. Question 21. A physician dictates an admission order for a patient requiring inpatient care. This type of documentation is found in which part of the medical record? A. History and physical, H&P. B. Progress notes. C. Physician orders. D. Discharge summary. Answer: C. Physician orders. This question tests familiarity with standard medical record components. An admission order is a specific instruction from a physician regarding a patient's care, particularly their entry into the hospital or specific treatments. All such instructions, whether for admission, medications, labs, or consultations, are formally documented in the physician orders section of the medical record. Question 22. Which payment methodology typically reimburses hospitals for inpatient services based on the patient's diagnosis-related group, DRG? A. Resource-based relative value scale, RBRVS. B. Outpatient prospective payment system, OPPS. C. Inpatient prospective payment system, IPPS. D. Ambulatory payment classifications, APCs. Answer: C. Inpatient prospective payment system, IPPS. This question assesses knowledge of healthcare reimbursement methodologies. The Inpatient Prospective Payment System, IPPS, is the methodology used by Medicare to reimburse hospitals for inpatient acute care services. Under IPPS, payments are based on diagnosis-related groups, DRGs, which categorize patients into groups that are clinically similar and are expected to use the same level of hospital resources. Understanding these payment systems is crucial for coders as coding directly impacts reimbursement. Question 23. A patient is allergic to penicillin and experiences a rash after being administered amoxicillin, a penicillin class antibiotic. This reaction would be coded as A. Underdosing. B. Poisoning, accidental, unintentional. C. Adverse effect. D. Toxic effect. Answer: C. Adverse effect. This question tests the coding guidelines for adverse effects of drugs. An adverse effect occurs when a drug is properly administered, correct drug, correct dose, correct route, but the patient experiences an unintended, undesirable reaction, such as an allergic reaction or side effect. Since the patient was allergic and reacted to a properly administered medication, it is classified as an adverse effect, typically coded with a T306050 code followed by a code from categories Y40 Y59 indicating the drug, and then the manifestation code. Question 24. What is the primary role of the American Hospital Association, AHA, coding clinic for ICD-10-CM/PCS? A. To publish annual code updates. B. To provide official guidance and clarification on coding questions. C. To develop new ICD-10-CM/PCS codes. D. To manage hospital accreditation. Answer: B. To provide official guidance and clarification on coding questions. This question assesses understanding of authoritative coding resources. The AHA Coding Clinic for ICD-10-CM/PCS is one of the 4 official publications that provide authoritative guidance for ICD-10-CM and ICD-10-PCS coding. It offers clarifications, answers to submitted coding questions, and coding advice, serving as a critical resource for ensuring consistent and accurate application of the coding guidelines. Coders must consult official resources like Coding Clinic to address complex coding scenarios. Question 25. A patient has a chronic condition managed with medication. The physician documents that the condition is stable. How should this be considered when selecting an evaluation and management E/M code? A. It indicates a high level of medical decision-making. B. It suggests a low level of medical decision-making, as the problem is controlled. C. It requires extensive documentation of counseling. D. It usually necessitates a comprehensive examination. Answer: B. It suggests a low level of medical decision-making, as the problem is controlled. This question examines how documentation impacts medical decision-making, MDM, for E/M coding. When a chronic condition is documented as stable, well-controlled, or improving, it generally indicates a lower level of medical decision-making because the problem presents minimal risk and complexity to the patient's management. A stable condition requires less physician work to assess and manage compared to an unstable, worsening, or new problem. Understanding the problem definition and status is crucial for accurate MDM calculation.